Hi everybody. Today we're here to talk about caregiving skills that you can't do without. Now there are a lot of skills, as you know, but the ones that I will talk about today are related to navigating the healthcare system and managing your health or the health for a loved one. I'm Pamela D Wilson. My website is PamelaDWilson.com. On there, lots of resources for caregivers and aging adults. My online course, my podcast, The Caring Generation, my book, my blog, so much help. It's kind of like a virtual home for caregivers. So let's talk about three skills that caregivers just can't do without. First of all, there is no substitute for learning and managing health so that you understand the diagnosis, medications, the consequences of not participating in preventative treatments, and the importance of ongoing care, which sometimes many people see as a hassle. They don't like going to the doctor. Well, who does? But if you have a goal in sight, it's probably a good thing to do. So all of this knowledge, gaining information, it means that you have to really do your own investigation into everything health related so that you understand. The research that you do will make you a better advocate for loved ones and yourself. I'm going to share a really simple but probably crazy example. You know that colonoscopy that you're supposed to get if you're over age 50, or that your parent is supposed to get, that everybody tries to delay by using one of those boxed tests. And I'm purposely not saying the name of the test because I don't want this to become a promotional video for ways to avoid a colonoscopy, right? Because they're important. So that boxed test has a relatively high success rate, right? The goal is it's going to identify if you have colon cancer. But here's the deal. It can't detect polyps, which are the cause of colon cancer. Only a full-blown colonoscopy can do that. Now, many people avoid them because they've heard about the PrEP. Well, the PrEP is a whole other story that, again, I'm not going to share here. But what I can tell you is, if you really put some thought into it, there are ways to make that PrEP less stressful and more easy and comfortable than you might ever imagine. Number 2 for skills caregivers really need are social skills that support positive interpersonal relationships and communication with everybody involved in the care of your parent. Now, if you have problems getting what you want in any area of your life, you might be thinking, oh my gosh, this is so stressful. I can't take it. It's not working out. Well, maybe it's time to look here. Maybe you have a communication issue or a gap in your social skills. Maybe you're not patient. Maybe you're not good at talking to other people. Maybe you're not good at establishing relationships. Well, this is the key skill for caregivers because you want to gain the support of others. That person at the front desk of your doctor's office, the person on the phone at the insurance company that you call, the nurse, the person at the home health care agency. Now, I'm not saying that caregiving interactions are not stressful because I've been doing this for 20 years. I know they are. But in many cases, you can turn these into positives if you just work on your social skills, your interpersonal skills, your communication skills. You develop a pleasing personality, and this results in people wanting to help you instead of fighting not to help you. Number 3 for a skill that caregivers must have is to really accept the fact that the healthcare system is not going to tell you everything that you know. Patients bear responsibility for communication gaps, asking questions, things that you don't know about. Most doctors, most medical care providers assume that you know information that they know. They assume that if you're not asking, you don't have questions, right? And the problem is they're so highly educated. They have trouble relating, I hate to say this, but to the general population, to the rest of us who may not be as educated as they are, or have the experience that they have, or know what they know. So it's up to you to be proactive in all aspects of healthcare for your aging parents, and more importantly, to follow through. Because those little things that you don't follow through with, oh my gosh, they can turn into huge problems. Here's a simple example. So maybe you had a skin biopsy because there was a question about, well, is this little spot skin cancer or not? And you forgot about it. Now, maybe you thought that that lab shared the results with your primary care physician and maybe the dermatologist that you saw, but you know what? That didn't happen. Your dermatologist never got the information. And guess what? 6 months later, you are told you have skin cancer when it could have been taken care of 6 months before. Following up on everything, even the smallest details, so that your healthcare and your parents' healthcare is not neglected, is essential. There's no other way around it. It's our responsibility. These are our bodies that we live in every day. So, skills that caregivers cannot do without: continuously learning to improve your skills, following through, becoming a pleasing personality, a person that people want to help. We all have an opportunity to continue to improve ourselves every day, if we choose. Today is the collective result, if you think about it, of everything that you did last week, last month, last year. What do you want your tomorrow to look like? Well, if you want your tomorrow to be better, it's time to start here with all of these tips about how to improve your caregiving skills. Now, also make sure that you go over to my website, PamelaDWilson.com. It's a home for caregivers, a virtual home for caregivers where there is so much help, hope, and support. I'm Pamela D. Wilson. Have a fabulous day today. I'll see you all again soon in another video.